town hall will be in English. We are also hosting town halls in Spanish and Cantonese this week. If you'd rather go to the Spanish or Cantonese town hall, below is the registration information. A few housekeeping items. Today's event is being recorded. Today's event is being streamed live through SFGovTV on channel 78, YouTube, and Facebook Live. For audio and video, we respect all participants in this convening today and want to create a safe space for all. By default, all participants will be muted and video is disabled. Video will be on for speakers only. To participate in Q&A, please select the Q&A button at the bottom of your screen to enter your question. Thank you all for joining. At this time, I will hand it over to Anna.
Thank you. Welcome, everybody. My name is Anna Velidzik, and I will be your moderator tonight. I am the COVID-19 team lead for schools, as well as the acting government affairs liaison at the San Francisco Department of Public Health. We are glad to have you all join us tonight for a town hall specifically for SFUSD families to provide information and answer questions about safely returning to school. A special thank you to Superintendent Vincent Matthews and the SFUSD staff for joining us for Q&A. They will help us answer questions after presentations from both UCSF and DPH. This event is being streamed live through the SFGovTV YouTube channel, as well as SFGovTV Facebook Live. There is a maximum capacity in this meeting of 1,000 people. So if you hear of others trying to get in, but they are not able to, please send them to the SFGovTV YouTube channel or Facebook Live. We will send a recording of this event after it is over. Please note, we will only be talking about COVID-19, the Delta variant, and DPH health and safety protocols for schools. We will not be able to discuss other issues such as school schedules or the availability of before and after care. The health department cannot answer these questions. It is really best to ask SFUSD and community partners instead. We will be taking audience questions through the Q&A buttons, as well as through the registration for this town hall. We will not be using the chat function. Since we have more than 1,000 people attending, we will do our best to answer as many questions as possible, but please understand that if we do not get to all of them in the next hour, we will try to respond to as many questions as possible, and we will email out materials and websites to all that have registered. Now, I would first like to introduce you briefly to our panelists for the evening. Dr. Daniel Wooldridge and Dr. Navina Boba. Will you please introduce yourself and what role you have related to COVID-19 and schools? Let's start with Dr. Daniel Wooldridge.
Good evening, everyone. Nice to meet you. I'm Dr. Daniel Wooldridge. I'm a pediatrician at UCSF in the Division of General Pediatrics, and I'm currently working in partnership with the San Francisco Unified School District to really help make sure that I'm educating everyone on the virus and on how we can reopen schools safely. And I will now turn it over to Dr. Baba.
Good evening, everyone. My name is Navina Baba. I'm the Deputy Director at the San Francisco Department of Public Health. San Francisco's Department of Public Health is overseeing the COVID response for the entire city, and schools is central to that response. So we are part of the team that is helping with school reopening and ensuring that schools stay open.
Thank you, Dr. Baba. Now I will pull up these slides for Dr. Wooldridge. Give me 1 minute. And then we will go into a presentation on COVID-19 and children, both on the variants and vaccines. Excuse me while I put this in present mode. Dr. Woolridge, the floor is yours.
Thank you so much, Anna. And yes, I'll be starting it off with giving you some tidbits about COVID-19 in children, the vaccines, and the variants. Next slide, please. So this slide is meant to show that COVID-19, since the beginning of this pandemic, and currently now, it is still mostly a pandemic very much driven by adult behavior. And I want to just take a moment to look at this slide here on the left, and we see in terms of the percentage of cases in the SF population, we can see that in those blue and gray lines, we can see that it's pretty much clustered around people who are starting at 21 years of age, and then it increases sharply at 30 to 39 years of age, and then it goes back down. But as you can see, children are not representing the majority of the cases, and they have not represented the majority of the cases throughout this pandemic. Over here on the right, we see that the deaths, however, sadly and tragically, are still very much happening to the aging population. And most notably, we're seeing it uptick once you get to 50 years of age, and then sharply go up as you get to 80 years of age. Next slide. So the variants, what has been in the news, and what we have all been concerned about, and what I'm pretty sure all of you came here to receive questions and answers about. So first off, let's take a step back and say that all viruses, including COVID-19, change to adapt to the environment around them. And when they create a mutation that allows them to better, or allows them actually a worse case for being able to adapt to their environment, they create what's called a variant. And it's something definitely that we've now started to pull more of our evolutionary virology colleagues into the fray on this, because again, this represents mutations that lead to essentially evolution of the virus. And the reason why variants happen so quickly is because a virus lives a lot shorter than a human does. And so generations, multiple generations, we can go through in 1 month, even a couple of weeks, versus what would take a century or more for us humans to actually go through and, become adapted to the environment around us. In terms of variants that we know of, there are 6 known variants, and our vaccines that are available are effective against the known variants, in particular the Delta variant, which originated in India. And that currently is the dominant variant here in the United States. Next slide, please. So this first note is super important because the Delta variant is more contagious than the original version of COVID-19 that first landed here. However, I want to make another note here that's not on the slide. It is more virulent and more contagious, but it is not more severe. The course of someone who does get COVID-19 is not more severe than it was before, but it is no less dangerous. And the fact that it is more contagious means it takes a lot fewer of the little tiny viral particles to stick onto our cells in our body and therefore cause problems and lead to sickness, illness, and death. We are seeing more cases of hospitalization from Delta, and this is largely being driven by the unvaccinated adults again. Children who are getting Delta have mild or no symptoms. And the most serious cases in hospitalizations are again among unvaccinated adults and also among teenagers. And I'm sure we'll get a lot of questions about that, but it's largely because children, in order to maneuver around in this world, they require us as adults to get them to places. And therefore we are the ones most responsible for things entering into their environment. The current vaccines available for 12 years old and older work against the Delta variant. And the vaccine, as it was intended to, prevents severe hospitalization and death due to COVID-19. And the slide we saw earlier where deaths were on the low compared to the cases in specific age groups, a lot of that is due to the fact that there are vaccinated folks out there. Adults being vaccinated from the original COVID-19 virus protect unvaccinated children. It is our responsibility as adults. We are the ones who protect children. The same is very much true for the Delta variant, that vaccinated adults, by getting vaccinated, provide that layer of protection for children in the exact same environment as the Delta variant. The FDA may approve the vaccines for children under 12 years of age, and we expect that to happen later this fall and into the winter. And recently, the FDA actually asked Pfizer and Moderna for more clinical data from their trials about vaccine side effects in children, so that before we make it available, we know exactly what to expect, and we can therefore plan appropriately. Next slide, please. And so this last slide. So the vaccine is one of the biggest layers of protection we can provide for our children. So anyone who is eligible to get vaccinated, I strongly encourage you to please get vaccinated. If you know people in your social networks who are unvaccinated, I strongly encourage you to get them vaccinated, because that will protect children. If you're worried as a parent about the fact that your child may be at risk for getting it in schools, so data has shown us, particularly data from much larger school districts in the nation that were open prior to the vaccine being made available to the public at large, that transmission between children and schools was exceedingly low. And it was exceedingly low compared to community transmission. That was the highest driver of surges, and adult to child transmission in homes. So in-home transmission is again, and community spread are again where children are at most risk. So COVID is not the most concerning thing in regards to schools. However, as a pediatrician and a big proponent of vaccines, there are things that do definitely pass between children in schools that you can get your child vaccinated against. And one of those things is the flu. Definitely earlier in the pandemic, we were actually seeing a lot more child deaths due to the flu than to the coronavirus. And that definitely passes from child to child. So definitely I encourage to get up to date on your vaccinations, including the yearly vaccine. Also too, wear a mask indoors, cover your face and your nose, please. Whole face has to be covered. If anyone has wondered why we test people for COVID in their nose, it's because the virus can also live there and in large amounts. And also to stay home when you're sick. If you are feeling out of sorts at all, don't be a hero. In fact, you will not be being a hero if you trudge through it and go to work. You'll be a hero if you stay at home and let someone know that you are feeling ill. We also recommend and are working to maximize ventilation or freshness of the circulating air, and also to wash your hands, wash your hands, wash your hands. Before the pandemic, it was sad the number of adults who wash their hands after using the bathroom. I'm not going to repeat those numbers because it's too darn sad. But I hope, because of this, people are a lot more invested in hygiene. So please wash your hands, sanitize. You see Purell, use it. I highly recommend it. And with that, I will definitely transition it over to my colleague, Dr. Baba.
Thank you, Dr. Woolridge. I am now going to bring up Dr. Baba's slides, and we'll share those, and we will get started. I'm putting it in present mode.
Great, thank you, Anna, and thank you, Dr. Woolridge, for that really informative presentation on the Delta variant. I wanted to turn a little bit now to talk about our school guidance. Next slide, please. So the school guidance is really aimed at making sure that we can have a safer return to schools. We know that schools are a safe place to learn, play, and make friends. And we want children to have that experience going into this next year. The risk of transmission is low in schools when safety measures are in place. Last school year, only 7 cases of in-school transmission among 48,000 students and staff occurred. And that's really incredible, but it also shows that there is good data and science on how schools can reopen and really reduce transmission. I will say that we are not expecting cases within schools to be 0. As Dr. Woolridge said, community transmission and in-home transmission will still occur, but the goal is that we have everything in place to prevent transmission from happening within schools to the best degree possible. There have been no verified outbreaks in the San Francisco Unified School District last year or within camps and learning hubs this last summer because of some of these measures. All of this is a risk-benefit ratio that each family has to decide. The risk of having their child stay at home versus COVID. And we in public health, as well as in the medical world, really do believe that school is the best place for children. And this includes because of the academic learning that occurs in schools, the physical and mental health benefits of schools, and the social and emotional development that schools afford. Next slide, please. So what are some of these safer strategies that will allow schools to return? Well, the first one by and far the foremost importance is vaccinations. And this is because, as I said, most children are getting COVID either in the community or at home, most likely from adults. So people who are able to get vaccinated should get vaccinated in order to protect children. Vaccines are one of the most effective ways to decrease risk of COVID-19. Vaccinated adults and teenagers can help protect younger children who cannot get vaccinated. And we know that vaccines are extremely effective, especially around severe outcomes and deaths. Vaccinated people are 10 times less likely to be hospitalized. The really good news is that in San Francisco, 77% of eligible San Francisco population is fully vaccinated, including teenagers in middle and high school. We need you all to help us get to that other 33% or 23% so that we can really ensure that everybody who is not eligible for vaccine is protected. Call 628-652-2700 or visit sfgov.gov, get vaccinated. Next slide. The second mitigation measure is wearing face covering indoors. And this actually yesterday, San Francisco required that all people who are in indoor public settings need to wear a face mask. And that's because face masks are simple and effective way to prevent transmission from happening. Face masks are, as in public settings, within schools, face masks are required indoors, but not outdoors. All adults and students must wear a face mask indoors at school, regardless if they are vaccinated or not. As I mentioned, face masks prevent the spread of the virus. Face masks are not required outdoors because outdoors allows for natural ventilation and makes the risk of the virus much lower. People who cannot wear a face mask can wear an alternative, such as a face shield with a drape. And schools should develop and implement protocols to enforce wearing face coverings. As I mentioned, it is an effective way to stop the spread of the disease. Next slide, please. The next layer of safety that we've added into our school guidance is ventilation. As I mentioned, The more that you can ventilate, the better the more that you reduce your risk to COVID. And so being outdoors is much more less risky than being indoors. Schools should use outdoor spaces as much as possible. When indoors, schools should open windows, improve their HVAC systems, or use portable air cleaners, or do all three things. SF Department of Public Health reviews ventilation systems at all school buildings, including the San Francisco Unified School District, before the SF Health Officer gives approval to reopen. Now, there are questions about what happens when there's a wildfire or poor air quality. At those times, schools should prioritize keeping healthy air quality indoors. So schools can stay open, but they can also close windows and maximize other safety measures, such as portable air cleaners, increased hand washing, and other measures. Next slide, please. There are going to be times when it will feel like school is completely back to normal, and I want to highlight that. First, with our cleaning and disinfection, we know now that COVID is less likely to be transmitted on surfaces. So cleaning once daily is usually enough to stop the spread of COVID through surfaces. Disinfection is only required in areas where there was a confirmed COVID-19 case. With vaccines given to those that are 12 and older, indoor masking requirements, and other safety measures, this will allow for no longer requiring physical distancing. So there's no longer the requirement of a 6 or 3 feet physical distance, and cohorting is not required either. Additionally, kids will allow to be outdoors in recess and can commingle. And they will also, as they go from classroom to classroom, also be able to go through hallways together. Next slide, please. Meals and snacks. As I mentioned, when outdoors is available to children, that should be utilized. So eating outdoors when spaces and weather allow is encouraged. For those children that are unvaccinated, they should be spaced to allow for the ability to take off their masks when they're eating. Food service can resume. Schools should clean frequently touch surfaces for meals, and surfaces that can come in contact with food should be washed, rinsed, and sanitized before and after meals. Meals do not need to be individually plated and bagged, and everyone should wash their hands before and after meals, as well as before and after snacks. Consider wearing masks between bites and sips. Again, if somebody is eating without and having to take down their mask, that is potentially a vulnerable time for COVID transmission. So being mindful of trying to limit that time. Next slide, please. Washing hands and using hand sanitizer will also help decrease spread. And this is not true of just COVID, but a lot of respiratory illnesses that happen within schools. So students and staff should wash hands or use hand sanitizer often, especially before, after eating, and after using the bathroom. One of the important reasons for this is that as we go into the fall season, we know that there will be more respiratory viruses like influenza, like the common cold, that will become more prevalent. The more that we can prevent students from getting this, the less likely they'll have symptoms that resemble COVID that might require them to be out of school. Schools and parents and caregivers can teach and reinforce all of these practices. And another very important point is children and adults should stay home when sick. If your child has any of the following symptoms, do not send them to school. And this list includes fevers and chills, cough, shortness of breath, fatigue, headache, muscle or body aches, new loss or taste of smell, sore throat, congestion or runny nose, nausea or vomiting, or diarrhea. Next slide, please. What to do when someone is sick at school? So staff who become sick at work must notify their supervisors and leave work. Schools should send sick students home. Students who are waiting to be picked up by their parents should go to a designated isolation area. For any of these, whether you're staff or student, contact your doctor and get tested as soon as possible. Next slide. And where can you get tested? There's greater access to testing through home test kits and healthcare providers. The department recommends testing for people with symptoms of COVID, even if they are vaccinated. There is emerging data that people who are vaccinated can still get mild cases of COVID. So to reduce spread, we do recommend that if you have symptoms, even if you're vaccinated, you should get tested. The other people who should get tested are people who are considered close contacts to someone with COVID and who are not fully vaccinated or who have not had COVID in the last 3 months. We do not recommend testing for staff and students without known symptoms or exposures to COVID, or staff or students who have had COVID in the last 3 months. And we do have a website that has lists of where people can get tested. Next slide, please. So the San Francisco Department of Public Health remains involved in supporting school reopening. We are actively working with SFUSD to set up vaccine sites at schools in fall of 2021. We have dedicated trained staff to respond to any possible case or exposure at schools. We have dedicated trained staff to conduct case investigation and contact tracing at schools. And we maintain school guidance and resources at the link below. And that will be the end of my presentation. Happy to take any questions.
Thank you, Dr. Baba. So here we are, we're going to spend the remainder of our time of the hour answering questions that were pre-submitted and that we have received live tonight. Again, please submit your questions through the Q&A box. We have volunteers gathering all of these questions tonight, and we will get to as many of them as we can. And the first question is for Superintendent Matthews. If Superintendent Matthews could unmute himself, please. The question is, will SFUSD return to full-time 5 days a week in person?
Good evening. The answer to that is yes. We are returning full-time 5 days a week in person. If you're struggling to, and the next question people ask, well, what does that look like? Just imagine December of 2019, but with everyone wearing masks. So we will be back in full-time 5 days a week.
Thank you, Superintendent. The next question is for Dr. Woolridge. What is known about the long-term effects of children who contract COVID-19?
That is an excellent question. And so what we know from children, or what's happening in children, is that when they do get COVID, most of them have mild or no symptoms, and therefore no debilitating morbidities that then happen afterwards. But that being said, they can still spread the infection. What we know about those children who have had MIS-C, or what it was called prior to us calling it MIS-C, Kawasaki's like syndrome or disease, is that pretty much that period of time, they should be monitored in the hospital, preferably in an ICU care setting. But personally, having taken care of some of these kids, as they resolve and as their symptoms resolve, they actually do get quite better. And we make sure that they have regular follow-up, not only with their general pediatrician, but also with folks that, specialists that take care of organs that we're most concerned about for any human being when they have to deal with any debilitating condition that lands them in the intensive care unit. One of them in particular is cardiologists, and also they may even be seen by a nephrologist. But again, from what we've seen, from what I've personally seen, and from what we've seen in the data, is that when children do get better, on the whole, for the most part, and the majority of them, they go back to resuming what they were doing before. That said, nothing is ever absolute in medicine. And so there will be a minority of children who may have really bad comorbid conditions after they heal from COVID. But compared to adults, much more minimal.
Thank you, Dr. Woolridge. The next questions are related to vaccine requirements, and this is for both Dr. Baba and Superintendent Matthews. Dr. Baba, the first part of the question is, will vaccines be required for students that are currently eligible to receive them?
So there's a couple of things that have to happen in order for vaccines to be required for schools. One is it needs full authorization, and that's because childhood vaccines are actually governed by the state legislature. So they would need to take it up, and they will take that up likely after full FDA approval for all children.
And then Superintendent Matthews, we have a follow-up question is, will vaccines be required for all staff at SFUSD?
No, currently, no, they're not required. We have strongly encouraged all of our staff to get vaccinated. As you recall, back in the spring, all of our labor partners came together to ask to be moved up the list, and we worked with the state to make sure that that happened. So we have encouraged all of our staff to get vaccinated. We are currently assessing exactly who is vaccinated, and we're going to use that data to determine what our next steps will be.
Great, thank you, Superintendent. The next series of questions are related to what happens if there is a positive case at the school. And I will start with the first one, which will be for myself. What happens if a student tests positive? So for all schools, if a student tests positive, we ask the schools to notify us immediately. We also get notified through a registration system with the state health department when there is a positive case. So we receive that in 2 ways. And then we work very carefully with the school and the school district in identifying who is a known close contact of that positive case, the recommendations for isolation, the recommendations for quarantine, and what the school needs to do and for next steps. This happened throughout last school year, including meeting with the school district on a regular basis for any cases that came up when they reopened in April. We're happy to say that, again, as Dr. Baba had highlighted in her slideshow, that there were only 7 cases of transmission within a school. Most of them were from community transmission, and we were able to minimize that through our prevention measures and then also properly isolating and quarantining everybody. And also, there were no verified outbreaks and there were no school closures related to COVID-19 last year. And we expect the same because we had been through several surges last year, and we predict that this surge will be no different from the strategies that we will employ. The next question is either for Superintendent Matthews or Chief Lau Smith. If there is a positive case in my child's school, will I be notified?
Thanks, Anna. Dr. Matthews, I can take that question. Yes, you will be notified in two possible ways. So as Anna said, if a student identifies first that they have tested positive, the first thing we do is identify the close contacts of that student. If your student was identified as a close contact, you would be informed immediately that your student was identified as a close contact and should start quarantining immediately. You would get that call immediately at whatever time we found out at the school site. If your student was not identified as a close contact, we would also send you what we call a general advisory memo that lets you know that there was a person on the site that tested positive for COVID-19. However, that your student was not identified as close contact, so does not need to quarantine. So you would get either of those two messages depending upon whether your student was identified as a close contact or not.
Thank you. I believe actually the next question would also be for you. The next question is, will students' attendance record be negatively affected if they have to quarantine or if they are a confirmed COVID-19 case?
No, it's the same as when your child is sick. It's an excused absence. So if you have to quarantine as being identified as a close contact, that does not negatively affect your attendance, nor if you're a student, your child needs to isolate because they have tested positive for COVID-19. Neither of those will impact your attendance.
Great, thank you. I think the next question is for Dr. Woolridge and possibly Superintendent Matthews, but the question is, will the typical fall flu result in school closures?
So flu season does happen every winter. One of the reasons flu season can be bad during the winter is not because of cold air, but because people crowd when the air is cold to stay warm. So that's one urban myth we can throw out the window. And I do not expect with flu season coming that schools will need to close. But as Dr. Baba mentioned, and as we talked about earlier, it is super important to make sure your child is up to date on the vaccinations that they are able to get, in particular the yearly flu vaccine. That way, if they do happen to get the flu, given those symptoms can look a lot like COVID symptoms as they are both respiratory viruses, we won't have to be concerned about, is this a possible COVID exposure or a flu exposure? So I would strongly, strongly say, please vaccinate, and again, please vaccinate.
I just wanted to add on, same thing. I absolutely don't expect us to have to close schools for the flu. And for the host, I'd be more than happy to turn my camera on if you would allow me to.
I will have our team work on that right away, Superintendent. And then quickly, I will just add on to not only encouraging everyone to consider flu vaccines for their children, but the measures of indoor masking requirements and hand washing will also help prevent the flu and therefore reduce the amount of any diseases in schools. The next question is, there's a series of questions related to masking. For Dr. Baba, we have a question on what type of masks does the health department recommend?
So it's a great question. We actually can provide you a link that will show you and explains the mask. But the best thing with masks is that they're well-fitting so that they do cover the nose and the mouth and that they don't allow air to escape in or out as much as possible. So cloth masks are okay as long as they're well-fitted. And we do recommend a double cloth mask, but there are other mask options as well. And again, we can get you the link. There is guidance around that.
Great, thank you. The next question is for Chief Lau-Smith. If a child forgets to bring their mask, is there an opportunity to be given a new one at school?
Yes, absolutely. We will have face coverings on hand to provide to students should they need one, if they forget it coming in or drop it or anything. But yes, we will have plenty of masks on hand for students and staff and adult and visitors who show up and don't have a mask. We'll provide that to them as well.
Great, thank you. If you wouldn't mind staying on, but I could leave the next question on meals is related. There is a question about meals is, can I request to have my child eat outdoors?
Sorry, I'm clicking the wrong buttons. That's a really great question. We are going to have meals outdoors as much as possible. And as many of you know, every one of our schools looks really different. So that will be more of a school site request or process. I do have to say that schools will have to figure that out in terms of supervision. Like they would probably need to have all students eating outside or all students eating inside or some combination to ensure, one, that our student nutrition staff, they can't be in two places at once for serving meals. We have to make sure students are safe and supervised during meals. So there will be definitely ways to think about how to have meals outdoors as much as possible. In the secondary schools, it's probably more of a situation where students would pick up the meals in the cafeteria and then possibly go out into outdoor areas, the quads or the courtyards, to have their meals. So it will look different at different schools, and that's definitely a conversation to look at happening at the school site on how meals are going to be organized. But we will be looking to maximize outdoor meals and just maximize students being able to have various ways to get their meals.
And one of the things that to keep in mind is we are working with all of our school sites. We know that this is a completely different situation than we've ever been in. And we know that we need to be flexible. So we are doing everything we can to do just that. We know we're going to have many requests as we come back in less than 2 weeks. And so just know that the school staff is going to try to work with you. But as Chief Lau-Smith just said, what's critically important also is that we have to keep students safe and they have to be supervised. So each school will be working to figure out just how to do that in the best way.
Thank you, Superintendent and Chief Lau-Smith. A follow-up question on meals that I will present to Dr. Baba. Can you please reiterate, is it safe for large groups of students to eat indoors in areas such as cafeterias?
There are definitely ways that it can be made safer. So again, spacing, minimizing when mask times are off, and allowing for ventilation can make that a better experience and minimize transmission of the disease.
Thank you, Dr. Baba. The next series of questions will be for the school district staff, and they are related to the question of distance learning. I will read them all together. The questions are, what distance learning options remain in place? Can students participate in distance learning if they have a vulnerable family member or if they have to miss school because of quarantine? I'm not sure if Chief Lau-Smith or Superintendent Matthews would like to answer either one of those.
So I'll start with the second part of the question. Can you repeat the second part?
Sure. Sorry, that was a lot. Can students participate in distance learning if they have a vulnerable family member or if they have to miss school because they are in quarantine?
So if they're in quarantine, schools will be working to get lessons to students and working with them. However, this goes to the first part of the question, what distance learning option? We know that the best way that we provide education, the most effective way is in person. We think it's important for students to return, and we want all the students who can return to return. So we are providing a distance option, an online program, but it's very limited. And it really is for cases where there is some vulnerability for the student. So that's the online option that is in place. It's very limited. It's for a small number of students because we really want students back. We have asked about, I guess we started maybe 3 weeks ago, 4 weeks ago with invitations, or at least the link went out to families to apply. We've had a number of families to apply. And then we will be determining which students will fall into those categories and will be a part of the online learning program.
Thank you, Superintendent. I believe you have answered all of those related questions. The next question is, what steps is a district taking to ensure that there are safe after-school programs available to students? And I actually will start to answer this, but then I will call on Chief Lau-Smith. But I will say that this, the San Francisco Department of Public Health also offers guidance for all programs for children and youth that are outside of school. And this includes childcare, this includes aftercare, this includes many of the summer camps that your children might be in this summer. And many of the measures are the same. We require indoor masking. We require hand washing and improve ventilation systems, and please staying home when you are sick, and encouraging vaccines as always. So much of what we presented here tonight is applicable to all of the aftercare programs. And this is where I will ask Chief Lau-Smith to speak specifically about the aftercare programs at the school district.
Thank you, Anna. Yes, so we have 3 different types of, I guess, aftercare programs. We have programs called our early education out of school time programs. We have our Excel after school programs, and then we have schools that have maybe private fee-based programs. All of those programs will follow the guidance that Anna mentioned and are required to. And as she said, most of the requirements are almost identical. And then we work very closely with either the community agencies for the early ed out of school time programs. Those are our staff. And then for the other programs that have what we call memorandums of understanding to have after school programs, we just work closely with those folks as well to ensure that if there's any need to contact trace or quarantine or isolating, we're communicating with everybody at that school site.
Thank you. The next set of questions are related to travel. First question is, will students be allowed to travel outside of the Bay Area during the school year? I will actually answer that one. Students and families currently are allowed to travel. We do not have a travel advisory or a travel quarantine in place that is required. We do both, the San Francisco and also the State Department of Public Health refer everyone to the travel guidance issued by the CDC, both for domestic travel and for international travel. And you can find those links in our guidance and online, and we're happy to share those materials out. So there is no restrictions on travel at this point in time, but there are recommendations based on whether someone is fully vaccinated or not.
And if I can, I would just like to add that if we think about like epidemiologically, like why we're seeing upticks, it usually follows periods where a lot of people are traveling. Just like how during November, a lot of people traveled during Thanksgiving, and then we saw upticks in cases. And unfortunately at that time, deaths in December, January, and thereafter. And during the summer, that is a peak time where people do travel for family vacations. People have barbecues. Rhode Island recently is dealing with their uptick in cases because they house the most well-known 4th of July parade because it was the first in the country. And the results of that large outdoor setting where not everyone is masked, pretty much you can best believe that there were people there sadly shedding the virus and then other people leaving and taking it home with them. And so what I have recommended for folks who do want to travel is I would, just as you would check the weather of wherever it is you're going to see what clothes you should wear, you should also check the vaccination rates, check the case numbers. That should be a part of your usual gestalt now if you are planning to travel at any point. And also yes, I would follow the guidelines that have been already mentioned.
Thank you, Dr. Woolridge. A next question, and I believe Chief Lau-Smith might know the best answer to this, is will Muni be able to be run so that children will be able to take public transit to school? And my understanding is MTA and Muni are working on that, but you might have more information.
Yes, you are correct. Muni, the school district doesn't run Muni and SFMTA, but we do work closely with them, and we understand, along with you, Anna, that they are working on ensuring that I think they call them day trippers, or the buses that generally service our schools, are the ones that will return to regular service. As I understand it, masking is required on all Muni buses, both, I think, before you get on, while you're on the bus. So I think they have similar type of masking policies as well.
Great, thank you. I do want to do a time check. It is 8:22. I know we have lots of questions. We were trying to get to them as much as possible in the last 8 minutes. We are getting a lot of questions related to close contacts. So the question is, can students who get exposed to COVID-19 and get no or mild symptoms still be able to attend school virtually? And I believe that is for the superintendent or Chief Lau-Smith.
Chief Lau-Smith, can you take that one, please?
Sure. I just want to make sure I understand the question. It said students who are identified as close contacts and are quarantined, could they attend an online program? Is that what the question is?
That is the question.
Great. So as Dr. Matthews said, for students who are quarantining, the school will be providing instructional materials for them during their quarantine period. There will not be a way that those students then can join the online program. That is very limited for students with particular circumstances. So we will not, it's not like you're going to go into quarantine and then switch to an online program. You will be at home quarantining with instructional materials that the school will provide to you.
Great, thank you, Chief Lau-Smith. The next question is for both Dr. Woolridge and Dr. Baba. Why is cohorting and physical distancing no longer required with masks and vaccines?
So I can start, and then definitely I'll tag teaming with Dr. Baba. So when this pandemic first started, we did not know as much about the virus as we currently do now. And because of that, we did full court press. And while we were doing full court press, particularly in school districts in the nation who were in session before the vaccine was made available, we were doing all of these measures, all of these things, because we did not know what worked. But we were collecting data on what worked in terms of preventing transmission. And the reason why cohorting and physical distancing is now not being promoted as widely is because the things that work and work best are the masking, eligible people getting vaccinated, very good hygiene, staying at home when you're sick. And those things, irrespective of how much distance you provide, are incredibly protective against transmitting the virus. And so right now we're in a period where we know what works after we've been really grinding through all of the data, all of the cases, and that is why. And I'll let Dr. Bava add on to that.
Yeah, thank you for that, Dr. Woolridge. That's exactly right. We are using the best science and data to guide the school reopening guidance. And there's been a lot that's been learned, both, with locally, within the state, within the country, and throughout the world, on how best to support schools to maintain their opening and ongoing education. So as was mentioned, it really is the things that we discussed: vaccination, masking, hand hygiene, and really importantly, staying home when sick or symptomatic, that make the difference.
Thank you. We have a question on school reopening. My school is not yet listed as approved to reopen, and when will this happen? And I will actually answer this question. We have been working very closely with the school district in reviewing all of the school applications for reopening. We have a set of the last 12 middle and high schools. They submitted to us last week. It is literally going through the ventilation review right now, which we expect to happen by the end of the week. And assuming that the schools pass the ventilation review, we will be issuing letters for approval by the end of the week. So please check the dashboard by the end of this week or by the latest Monday for the most up-to-date information. We're going to ask one last question, and this is mainly for the school district staff, but anybody who would like to answer, is what can parents and caregivers do? How can we prepare our children to return to school? Maybe I'll start with you, Superintendent Matthews.
So a couple of things. Thank you. Thank you for that question. Couple of things. First and foremost, if you are 12 and older, get vaccinated. If you have not gotten vaccinated, please get vaccinated. As you heard Dr. Baba say, we still have 23% who we want it at 100%. So please, first and foremost, get vaccinated. I think the second thing is that we are definitely going to be spending the first few weeks of school really around building community and building relationships. We know that some of our students were able to return in the spring, back in April, but many of our older students have not been back on campus. So we are going to be spending time building relationships, building community, and we want to make sure that students are aware of that and know that because we know you're coming back into a place where you haven't been in a while. And plus, when we think about the virus and think about COVID, it's important that we spend time giving students the opportunity to just get to know the schools, get to know their staff, get to know their classmates. And we want them to know that we care about them, care deeply, and we're doing everything we can to make sure that the environment that they come back to is a safe environment, and we want them to know that. Did you want to add, Chief Lousmith?
No, I think you really were spot on with your comments, and I just would reiterate getting vaccinated if you're eligible, and really monitoring and doing those symptoms and staying home if you're sick. That will really help us keep the school safe. And, just spend some time sort of talking to your students, your children, about what are the routines that are going to happen in the schools, wearing your mask all day, staying home when you're sick, all of those types of things, just to get them used to the new routines. But we're really excited to be able to open up our schools in less than 2 weeks. And we can't wait to have your students back teaching and learning, all of us together again. So we are really looking forward and we can make it safe for all of us.
And I just want to, if I can get 30 seconds, just to go right back to what Chief Loud-Smith was just saying. One of the things that I actually said back almost a year ago now, or it was a year ago, is that how important it is that we take care of each other. And for your children, one of the ways that we all take care of each other is what Chief Loud-Smith just said. If you are sick, do not come to school. Tell your parents, let you know any signs whatsoever, stay home. That's how we all take care of each other, and that's how eventually we'll end up beating this virus.
Thank you. And sadly, that is the end of our time. We want to thank all of our panelists and all of the people participating in answering our questions and answers for making the time to be with us tonight, as well as the host partners, the Department of Public Health, the UC San Francisco, the Department of Children, Youth and Families, and SFUSD. And a big shout out to everyone behind the scenes. We know that there are many more questions than we had time to answer. We will work to get these answers to these questions and share that information through all of our respective organizations. We will also send materials and send out recordings of this meeting that is on SFGovTV YouTube channel and Facebook Live. Thank you again for being here, and good night.